Hey everybody, today I want to talk to you a little bit about nipple shields. Nipple shields are one of the most common tools that are used in the lactation world. They can be used for a shallow latch to help protect the nipple. They can be used to help heal a nipple. We might use them when there's a tongue-tied baby and we're trying to manage that, figure out how to get baby released and revised, and working on mouth skills so that they're not ripping your nipples off. They might be used if you have a flat or inverted nipple. Some people may use them in the hospital after birth if too many fluids have really overloaded your breast. But what I really want you to know is that nipple shields are not one size fits all. Most hospitals will only have 2, maybe 3 sizes if you're lucky. The hospital I worked at had 2 sizes, and every once in a while we would get a third. The standard one is your Medela cone-shaped shield. That's a 24 millimeter that's supposed to match those 24 millimeter flanges. And they might have a small, which is a 20 millimeter. Every once in a while, you'll find a rare hospital that has a 27, which is a large. But they're a cone shape, which honestly is not the shape of most of your nipples. So unless you have a long everted nipple, most of the time when these go on your nipple, they create an air pocket where baby bites. So for one, you need to be placing your nipple shields correctly, and I'll talk about that in a minute. But for 2, there is more than just this nipple shield, and that's the big takeaway that I want you to learn today. So there are cherry-shaped shields. This is the MamaVac cherry-shaped shield, and you can see that the tip of that is rounded and much shorter. So the cherry shape is actually what I prefer for most people because of anatomy. It's all individual based on your anatomy. But anytime somebody comes in with a nipple shield and it's still painful, we're changing shields. You might need a smaller shield or a different shape. There are also more rectangular shields. This one again is going to be shorter than that Medela you got in the hospital and a slightly different width. There's ones, this one's from Lactation Hub. A big complaint is that they slide off, they fall off. Usually it's the wrong shape and size, so it doesn't work well for your anatomy. This is Lactation Hub's, and it's not quite a cherry shape, right, like the MamaVac, but it's not quite a Madonna cone boob. It's more rounded, and it has a little bit more texture on the sides so that it does stick to the skin a little bit better and doesn't slide as much. And then there's all different thicknesses of these. This is my favorite as a step down. This is called a Lovey. I order mine from Lactation Hub. I don't work for Lactation Hub, but I order all my products from them, so shout out to Lactation Hub for supplying me with all of my products. The Lovey is my step down. It's got this nice rounded, again, shape, but this is the thinnest of the shields, so it's really easy for baby to grab onto. You get more stimulation through this shield. The baby gets a little more sensation in the mouth, but it's thinner, more pliable, so I like it as a step down. So lots of different shields out there. So if you think that there's only one kind and brand, not true. You might need a different shield. Now, when you're going to put a shield on, what I normally recommend is take your nipple and stimulate it just a little bit so that it comes out as far as possible. And then when you're putting your shield on, you actually need to flip the shield so that it makes a little nipple cup, okay? And then you need to get it as far onto your nipple as possible and then stretch and pop it on so that your nipple goes in at least halfway, if not 3/4 of the way into that shield. If you just stick it on like a Band-Aid, baby's just gonna nipple munch through that shield and still cause pain and damage. So you have to make sure that that nipple is most of the way in the shield. If your nipple's like this and there's this big airspace, this is the wrong size and shape shield for you. You probably need, again, you're gonna flip it back, you're gonna get that nipple in as far as possible, flip it on. Look at that! All of a sudden, wow, that nipple actually goes most of the way into the shield. And honestly, this is the majority of the nipples that I'm seeing in my practice. Small diameter, shorter nipples, normal nipple anatomy. So the shield is going to then help protect that nipple while baby's trying to learn to latch, while you're healing your nipples, while baby's getting a tongue tie release. So the 2 takeaways from today that I hope you learn is 1, nipple shields are not one size fits all. You might need a smaller shield or a different shape. And 2, shield placement makes all of the difference in the world to make sure that you're getting a deep, pain-free latch. If you're struggling with your nipple shield, if you're struggling getting off of a nipple shield, if you can't find the right shield, if your baby is not latching with a nipple shield, please make sure that you find a qualified lactation consultant, because we love our boob jobs and we can help you find the right one. If you want to come work with me, you can schedule an appointment at lalactation.com. You can find me on Instagram, Facebook, and YouTube for all kinds of tips, tricks, and hacks. All right, that's it for today. Now you know.